Do you have questions about your health? Do you need to find out what's keeping you from feeling your absolute best? If so, your intuition has guided you to the right place. I am Dr. Charlize, and welcome to the Art of Healing podcast community. In this podcast, we explore all topics in health and wellness, from Reiki to functional medicine, energy medicine, chakras, and meditation. Join me every week for fresh new episodes that highlight healers, various healing modalities, and use this as your opportunity to find what healing works best for you. If you want to learn more about me, simply Google at Dr. Charlize. Enjoy. Okay, everyone. So thank you so much for joining us for a live recording of the Art of Healing podcast. I am Dr. Charlize, and I'm so appreciative for those of you that join us live. If for any reason you need to hop on or hop off, we absolutely understand. Of course, we'll have question and answers. And if you do have a question, just put it in the chat because we are recording this for the podcast. If you miss any part of this or if you have to hop off early, the Art of Healing podcast will have this episode go live. And if everything goes fine, we should be posting the episode on Monday. So nice to meet all of you. Some of you I've met before. Some of you I've known my entire life. Some of you I've known in past lives. Yay, I'm so excited. So we'll go ahead and get started. And then hopefully I'll be able to give a little teaser of a really cool group program that is coming up. So if we are all ready, and Dr. Marsh, are you ready?
I'm ready.
Oh, perfect. Dr. Marsh is a world traveling physical therapist. Dr. Marsh claims Oklahoma City and DFW Metroplex as home. She currently lives in Atlanta, Georgia, and she works full-time as a school-based therapist with Atlanta Public Schools and as a small private practice that services early intervention patients. Tara received her Doctor of Science in Physical Therapy from Alabama State University. She has practiced physical therapy since August of 2003, so she's very experienced. Tara has experience with therapy in several settings in her career, with her initial start in outpatient orthopedics. Tara continued her physical therapy journey practicing in school districts, Texas and Georgia, Army Base Fort Stewart, as well as physical therapy in the Warrior in Transition Battalion, or what's called WTB, aquatic therapy supervisor for the WTB in acute medicine. She works with therapy abroad as a clinical supervisor and Skilled Connections nonprofit as a physical therapy board member and volunteer. Both organizations provide services in the United States and abroad. Dr. Tara Marsh received her RYT 200-hour yoga instructor certification in April of 2022 through the Kaivala Yoga Method and Mindful Purpose Institute. She has been certified as exercise physiologist through the Academy of Sports Medicine and is an aquatic therapist through Aquatic Therapeutic Institute, or ATRIC. Tara's main passion is to empower individuals to live a fulfilled life, and she finds joy in supporting families and service members to promote holistic health and wellness. So I asked Dr. Marsh to join us because she is in the midst of launching her YouTube channel. And in addition to her practice, she is in the midst of launching her yoga instructor practice. And so she's getting ready to really spread her message out there. She has got so much wonderful information to share. Dr. Marsh, how are you?
I'm doing great. Thank you for having me today. So great to see you and hear you.
Wonderful. Can you remind us your YouTube channel and your website if you have those live yet?
I'm currently working on the website. It should be live by the end of the weekend.
Perfect.
It's Yahweh-moveswellness.com.
Okay. For podcast listeners, if you sign up for my email newsletter, I will have all of her contact information that'll go out there. Can you share some about your journey in physical therapy and what inspired you to pursue physical therapy as a career?
I've always had a love of medicine and healthcare, and I was an athlete in high school. Fell in love with that side of things. So I thought, sports medicine and health, that goes together for me. And that's what helped me pursue physical therapy. So once I got into physical therapy, I realized there were different types of therapy that you can do. It ranges from geriatrics all the way to pediatrics. And I've always loved children. I thought I was going to stay with adults and sports medicine, but somehow I ended up being on the floor playing with children. So I have worked in every setting and have enjoyed and learned so much through each experience. The important thing that I've learned through this journey is that functional outcomes are very important. Everybody wants a good quality of life. And if you can show them how to get there, you just make the world a little better.
As a physician, I think that, or what I've noticed in my time of practice is that the amount that I end up leaning on physical therapists is massive. And I come to take it for granted until like something really shocks us, like, wait a minute, I just did a lot of talking, but I wasn't the one that got them moving. That was a physical therapist that got them moving. I just talked about it. You have practiced in a lot of settings, school districts, military bases. You've practiced in the United States and you've practiced abroad. So, how has the diversity of your experience shaped your approach to physical therapy?
It definitely makes you look at the person completely. It changes your mindset and helps you even eliminate some of your biases that you might have. It will make you ask yourself, am I looking at this completely as the person? Because you do have to take into consideration that person's culture. You got to take into consideration what that person is telling you. You become a better listener, become more of an active listener when you work in different settings, and especially even different cities. Because the culture of one city or one town is completely different than another. What's important to one person will not be important to the other based off of their family dynamic. Those things are really important when you're trying to get somebody back to moving because you want to establish things that are based on what's important to them. What are your goals? What do you want out of this? Because what we do as physical therapists, we encourage you to move, get up and do all the hard things that are painful or difficult in that moment, but it takes your effort and your motivation to participate. And my goal is try to keep you motivated. So, yeah, definitely. I've learned so much. It's been such a great career. And just learning about how to appreciate humans and human nature and how things work all for the good is a wonderful thing. So, yeah.
Oh, that's beautiful. So you had a lot of years as a physical therapist. So what sparked you into yoga? What got your attention on yoga and even enough to pursue becoming an instructor?
My own health and wellness, definitely. This job takes a lot of effort and work and mobility on my end. We learn how to transfer patients, get them out of bed. So it's a lot of work on our end. So we have to really take good care of ourselves in order to be efficient on the job. And then I really have a love for manual therapy and pediatrics. Both of those are my favorite specialties in physical therapy. And what comes with manual therapy is you're going to see a lot of people with chronic pain. You're going to see a lot of people with hip pain, back pain. So I ended up teaching a lot of exercises that had half the yoga movements in them already and a lot of Pilates exercises because there's a lot of core training and breathing is so important. And I wanted to investigate it more because we do understand the anatomy and the physiology on this side of the medical world, the Western side. But I wanted to dive in a little bit more just to understand And so I was really intrigued with yoga, and I started performing yoga myself, and I started seeing the benefits and realizing, oh man, I'm gaining flexibility, I'm gaining strength. But not only that, my anxiety is decreasing. There's
Mhm.
other benefits. It's not just the physical side. So it just made me want to research and learn more. And then I ended up becoming a certified.
That is pretty interesting because you've already got that intense physical therapy training. And then you get to use your body when you work with your patients. And then to imagine that another discipline adds to what you're doing, especially because you're already athletic, you're already active. That is kind of interesting. So as you started to kind of cross that bridge, did that start sparking certain questions within you? And were there certain things that you began to wonder about? And I mean, keep in mind, we're the Art of Healing podcast because we're pretty straightless now. We're going to get weird later on because we're going to get way into chakras. But we always start kind of Western a little bit, and then we get Eastern. Were there certain things in particular with you? Yeah, I know Toy's laughing that you noticed as you were learning this, or some of it that was even a little like, I don't know, like maybe scary if you were on started your yoga journey?
I believe that I always knew that physical therapy, and I remember one of my professors telling me that physical therapy is an art. And I was like, really? It isn't an art. I'm coming in with my scientific brain. And I do definitely have an artsy side to me, but I just never looked at it that way initially until I actually started working with people and started realizing how creative and how we as PTs, we see people every day and we get to find out about their lives, what's going on. We get to know they tell us some things that they won't share with anyone else because we become part of their life while we're treating them. And so I knew that there was always this other side to wellness that existed, that it wasn't just doing a certain set of exercises and you're going to feel better, that it had to be more. And of course, I know the physiological side, but there's also that emotional, there's also that mindset. And I feel that when I tapped into more of the yoga practice, I was like, there's just more to this. And when you start involving the practice in just really sitting down, listening to your body, listening to your breathing patterns, and finding out exactly where the pain could be coming from. And realizing that your body is really intuitive to you if you would listen. I wanted to know more about that and see how I can help someone else find that for themselves.
Wow.
And I believe that movement is medicine. And I believe that also it's empowering for anyone. And it doesn't matter how much movement you have. If you're able to move, you gain a sense of independence and ability.
So I noticed on your Instagram, you started, I think they're the car talks. It's going to be 40 days
Yes,
of car talks.
yes.
Yes, I love that. And you started right away in the discussion of chronic pain. And I love that. And, you and I have talked about chronic pain, the journey of chronic pain. Just give us sort of a rundown of your thoughts on chronic pain, especially as you are starting your yoga instructor practice. And
Oh,
when it comes to chronic
definitely.
pain, you are going to be the kind of the beginning, the end, yeah. Can you tell us about that?
Starting from, I don't even remember when I had my first experience with chronic pain. It was probably prior to working at Fort Stewart. We run into a lot of chronic pain there due to the nature of the military um, and what our soldiers have to do. And so understanding the mechanism of pain and that it's an alarm system for our bodies, correct? And so it can keep going and it remembers that trauma. And that's been proven in science and you can see it in actuality. But encouraging people to recognize that your body is telling you this, but I want you to look at it, see it, and I want you to move it and tell me if it's broken. And getting them to a point to be functional is so empowering for them. And it's something that needs to be addressed because it's so complex and it has so many different facets, correct? It has not only just the physical portion, the mental, emotional, but there are caregivers and practitioners that are ready to help people get to that point. But sometimes I feel like everything gets so scattered that people don't get what they need. And they don't know how to empower themselves, and they don't know what questions to ask their physicians. There's just so many questions out there. So I feel that it's an important topic because it's such a big topic that affects many people, because it doesn't just affect the person, as we know, it affects their families, it affects their friends. And so providing information and even just practical knowledge, like have a list of questions that you want to ask and make sure they're open-ended so that you can really get information. Find sources and links that you can ask about and ask your physicians about that. A lot of people just go and think, okay, well, they just told me what I needed to know, but I'm like, you could have asked more questions. Sometimes the physicians are extremely busy and forget to give you more. So sometimes you have to be that proactive person to ask, and anybody that's involved in your health, ask, because the person needs to understand that they are an individual and they should be seen individually. They're not in a certain box. This is your situation. This is your experience. And what do you want? What do you want to gain? And that's why I wanted to focus on chronic pain. I've learned that even through yoga, through physical therapy, through manual therapy, all of it can help. But when you learn how to move yourself, that's going to be the most helpful. But all those modalities are used to get you to where you can be independent, if that makes sense.
That makes perfect sense. So you said something, and so I will just be frankly honest because you're so sweet. Guys, she's always been so sweet. I've known Dr. Marsh and Tara for 30-ish years. She's so sweet. She's not gonna say it. I'll say it. Okay, when it comes to chronic pain, what happens? Allopathic or Western medicine can diagnose it. Uh, Not always, but can get to the diagnosis. Modern medicine or allopathic medicine can offer surgical treatments, can offer medical treatments, but medications are going to be band-aids. You're just going to cover it up. But for when people begin to identify with chronic pain, meaning I've had pain for over 3 months or 6 months, and the doctor is telling me the cause of the pain is gone, why am I still hurting? That is a point that you are abandoned by modern medicine. You are abandoned. You're alone. Unfortunately, we can calm the pain, we can quiet it, we can mask it, but we don't really get to much of a solution beyond that. But what Dr. Marsh is venturing out there and saying is that your body is telling you something. And maybe we've cleared out the scary things. If there was a cancer, we found it, we treated it. If there was an inflammation or something that was glued to something else that wasn't there, we did surgery, we removed it. But now your body's telling you something. So that's where Tara, Dr. Marsh, is inviting us to now get to know that part of the body and even move it. And speaking of move, because you are teaching yoga now, you're actually going to be offering instruction in person, locally. And then the biggest that I'm so excited about is that you are launching your YouTube channel. So you mind sharing with us some about that?
Definitely. I will be providing information, poses. I'll be doing some of the flows on the YouTube. I plan to develop an online platform for online classes as well.
Mm.
Definitely getting exactly what you said out there. Really acknowledging your body, getting it moving, and alleviating your pain.
Mm.
Using active motion, awareness, breathing, all of the above.
Oh, that is wonderful. That is wonderful. So, the way we'll do this, because Dr. Marsh is busy, she's practicing and she's teaching. So, what I'm going to do is I'm going to pressure her now to come back on the podcast. Because I work like that. So I'm already offering her that she will be back on the podcast because especially as she gets into her YouTube channel and things, we want to make sure you all know where to find her. But if you'll see in the chat, there's going to be a link that takes you to a sign up page. That's for my email list. And the email list is kind of the most reliable way that whenever there's a podcast episode that comes out, it goes out there first and particularly for Dr. Marsh's contact, because all of her contact info will go out in an email, and it's going to be over the next few days. We have a few minutes if anyone has questions, because you've got a doctor of physical therapy here and a yoga instructor. If you don't mind taking a few questions, Dr. Marsh. So maybe even if you've got like a chronic pain somewhere, you might want a little bit of insight about a chronic shoulder pain. I'll tell you, so I did my first physical therapy, Dr. Marsh, when I started to have some arthritic pain in my right shoulder. And I found it so fascinating once I went, because we were working on like breath and then different poses and things. And then it got me to thinking about like what even made me hurt here. It ended up being an arthritis in my AC joint, which I did physical therapy to work that out. What would be your insight on like a physician that gets arthritis in her right shoulder? Now I can kind of feel it when it comes up and, I'll send a little Reiki to it. I know for me, like if I'm midday working, I'm getting really wound up and stressed out. It's like, boop, boop, and then the weather's changing. It kind of like, it like knocks on the door like, hey, what's your insight on that?
I would definitely look at how you're sitting in front of your desk typing. It could be a postural thing. It could be how you react to stress. Do you rely on that side of the body more?
Yes.
Your muscles and everything, you're going to react that way. So it could be closing off that shoulder joint. Okay. It's also probably some postural going on there. If you're working at the desk quite a bit and at the computer, you're leaning forward more. You could have some neck issues. You're going into that flexing position and staying there. So those muscles are just staying tight. Over time, arthritis is mostly due to overuse and just working in that area. And so the good thing is to breathe, go into that extension mode, open up that joint, and take breaks, Dr. Charlize. You might need to take a few more breaks during your day and allow yourself to really stress that shoulder out. Once again, your body's telling you, you get stressed out, you tighten up here, everything over here locks up. I need you to take a moment, at least a few times out of the day, breathe, open up, extend, and that will relieve a lot of those symptoms for you. But once again, your body's telling you what it needs.
I love that. I love that. Yeah, you're exactly right. Because once, not that I believe I was invincible, but once I actually got the diagnosis of arthritis, I had some feelings about it. I was like, I can get arthritis. Am I going to get arthritis all over? Old? Am I? It was like,
Right.
and then the one positive to it is that little arthritic spot is this perfect weather predictor. I used to remember like our parents would talk about that, and I think they're so old. But now I'll feel that shoulder wake up and it's like, that weather's coming. So, Dr. Marsh, can you remind us where we can find your social media handles? I have shared your Instagram, but can you just remind us the best places to find you and best way to get in contact with you in case we have questions?
Yes, YahwehMovesWellness.com. Also, Yahweh Moves on YouTube. I'll be available there. And Marsh Therapeutics is open and ready. And that's on Instagram.
Wonderful. I would encourage all the podcast listeners to tune in for Dr. Marsh's Car Talks. They're so insightful. I have really enjoyed them. Thank you so much for joining during this episode of the Art of Healing podcast. If you found this episode helpful, please leave a review. Also, you can check your show notes to find out how to get a copy of this and future episodes emailed directly to your inbox, available to listen to anytime. Finally, if you have questions or wish to connect to me, check your show notes to find out how we can get connected and find out how I can be of service to you.